Good morning, July 10, 2025. We are live streaming spine surgery from Deuk Spine Institute. Our patient's from Florida. You can see from the x-ray he's had an artificial hip put in. To have that artificial hip put in, they put a huge shaft that's metal down into his femur, and then they connect it to a little ball head and a socket that's made out of metal. Now, when the surgeons do this procedure, the artificial hip, they do not release the piriformis muscle, and this patient has, I believe, piriformis muscle pain that's going down his left leg. Are we ready? All right, we got a nice rotation shot. Now, the piriformis muscle attaches right where that window is. You guys see the window in my instrument?
Yes, we do.
All right, that's where it attaches. Now, I believe he has a torn muscle, and it's causing what we call sciatic pain. Why would the piriformis muscle cause sciatic pain? The reason is because the sciatic nerve runs right through the piriformis muscle, deep within the buttock. Most people don't know that. So let's show the audience how is it that piriformis syndrome can be so painful and cause sciatic pain.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see that when the piriformis muscle gets torn, it can actually cause pain in the lower back plus pain down the leg. Now, if we look here, you can see the incision is only 4 millimeters. It's a tiny, tiny incision, and it's a basically bloodless surgery. You lose just a few drops of blood, and that's it. Now, he's going to have some pain in the back of his hip here for about a week, and then that pain will go away. We're going to get his staples out tomorrow. But that's it. That's a piriformis muscle release developed here at Deuk Spine Institute. It's minimally invasive and percutaneous. Great job, everybody. Any questions?
No current questions.
Thanks, Henry. You can show one of our testimonials, and we can end the stream. And good morning, I'm Dr. Deuk, and I'm here with a patient from Kentucky who came here for a couple of issues, but one of them was piriformis syndrome. She had a torn muscle in her buttock. It was balled up tight with scar tissue, spasming all the time, causing buttock pain and compressing her sciatic nerve. So she had sciatic pain down her leg, and you had the Deuk piriformis release yesterday. How do you feel?
Today, I feel really good. I no longer have pain going down my leg into my foot and heel. I just have some muscle soreness now, and we're at the surgical site.
And how long have you had that piriformis syndrome?
At least 8 years is when I first noticed it.
Yeah, 8 years. So, and the muscle was very scarred, and when I had to release it, I could feel how thick it was and how tight it was. So It went very well for you. What kind of problems did the Piriformis syndrome cause for you in your life?
It got to the point where I would not leave the house because I could only go to work and come back because it hurt so bad to work and to do anything after work. I've had 2 surgeries on my hip. The second one was a total hip replacement, and the pain was still there.
So you had hip surgery that didn't even fix the problem, and then you
Right.
came to Deuk Spine and you woke up.
And it's much better. I can walk without pain in my foot and leg. Like I said, just muscle soreness at the surgical site now.
How did you hear about Deuk Spine Institute?
Online, I was Googling my symptoms and your website kept coming up and I ignored it for a while because I really just wanted to stay in my area if I needed any surgery done. And I finally decided, well, there's no one in my area who can help me. And so I clicked on your name and I thought, wow. Started watching your videos and saw that you had a free MRI consult.
Mm-hmm.
So I did that. Now here I am getting it taken care of.
Well, you hit the nail on the head. There's no one in your area that could help you. And that's true for millions of people suffering with back pain. Their doctors cannot fix them. So that's why we are so active online, trying to make people aware that there is help for them. But they have to travel to Florida.
Yeah,
Oh,
yeah.
well, right?
Yeah,
Beaches.
it's an easy jump down here. So
Yeah, and you
Yeah.
could see in the surgery, we went in with a 4mm incision. And this is a pioneering new technology where I went in and released the piriformis muscle with almost no bleeding, no hospitalization. It was outpatient. So you actually went to your hotel with your daughter right afterwards, and here you are today.
here I am.
So how is life looking for you now without this piriformis problem?
So much better. I am looking forward to getting back to my normal level of activities. One of my goals is to get out and hike, again, 5 or 6 miles a day. And like I was doing, I'm looking forward to that.
Awesome.
Yep.
Anything else you want to say to your family and friends and fans out there?
I would say that, do your research, but you're going to end up back with Dr. Deuk. There's no one like him that I found. I did a ton of research throughout the country at first, and then I focused on my regional area, and there was, you're going to come back to Dr. Deuk without any hesitation.
And we welcome everybody because we want everyone out of pain. That's our goal.
Yep.
That's our mission at Deuk Spine. Get rid of pain permanently so people can have a normal life and enjoy life.
Right.
Well, congratulations.
Thank you.
You took the leap of faith. You came here and got it done.
Yes, absolutely. Thank you so much.
You're welcome.